My name is Paolo Amami, and I am a neuropsychologist. I work in the clinical neuropsychology unit of Carlo Bessa Neurological Institute in Milan, and today I'm going to present our data on the cognitive outcome of essential tremor and Parkinson's disease patients treated with MRI-guided focused ultrasound for tremor. From 2019 at Bessa Neurological Institute, we screened 168 patients candidate for MRI-guided focused ultrasound. They had diagnosis of essential tremor, Parkinson's disease, or dystonia. Today, I'm going to present data only on essential tremor and Parkinson's disease patients that reached the 6-month follow-up. From a neuropsychological standpoint, the exclusion criteria were the occurrence of dementia, defined as a cognitive impairment severe enough to interfere and limit the activities of daily living, or of the occurrence of a major psychiatric disease not controlled by the ongoing medical therapy. So, we collect data on 25 Parkinson's disease patients and 32 essential tremor patients. This table shows the neuropsychological battery administered to patients at baseline 1 month, 6 months, and 12 months after the surgery. I'll present only the 6-month follow-up data because the majority of the patients have now reached the 1-year follow-up. As you can see from the table, our neuropsychological battery included tests assessing short-term memory, long-term memory, verbal and visual, attention and executive function, and visuoconstructional abilities. For MoCA test, for raise word list, and for raise complex figure, we use parallel versions of the test. Our series included 25 patients with a diagnosis of Parkinson's disease and 32 patients with a diagnosis of essential tremor, for a total of 57 patients treated with MRI-guided focused ultrasound for tremor. As you can see, there were no differences between Parkinson's disease and essential tremor patients at baseline. All the patients, except for 2, had right-hand dominance, and the majority of patients received treatment of the left hemisphere. All patients had a good response to the treatment. This table reports the raw score of the cognitive performances of the whole population at baseline, 1 month, and 6 months follow-up. At 6 months, the comparison showed a little increase of score of MoCA tests, multiple feature targets cancellation tests, and verbal fluencies, both for phonemic fluency and semantic fluencies. On the contrary, there was a decrease of long-term verbal memory performances. However, this decrease was still in the range of normal scores. We also ran post-hoc analysis regarding MoCA, semantic fluency, and phonemic fluency. These show that the performances of MoCA increase a little from baseline to 6-month follow-up, while score of verbal fluency followed a U-shaped curve. The slight decrease of performance that we observed soon after the FUS was recovered to baseline level within 6 months. We also investigated eventual differences in cognitive outcome depending on the neurological diagnosis. Therefore, we analyzed the cognitive performances of essential tremor and Parkinson's disease patients between baseline and 6-month follow-up. As you can see from the table, compared to baseline, both groups had decrease of performances of tasks assessing long-term verbal memory. You can see here and here. There were other differences between baseline and follow-up in both groups, but these were little increases with no clinical significance. We were also interested in analyzing eventual differences depending on the size of the brain treated. In particular, we speculated that the decrease observed in long-term verbal memory and not in long-term visual memory was because the majority of patients received FUS on the left hemisphere. Therefore, we selected only patients with right hand dominance, and we investigated the differences in cognitive performances between baseline and follow-up in patients that received left and right hemisphere treatment. We expected that patients that received treatment of the right hemisphere had no decrease in verbal long-term memory. As we can see from the table, in both groups we observed a decrease in verbal long-term memory. These results did not suggest a direct effect of FUS of the ventralis intermedialis nucleus of the thalamus on long-term memory function, but may suggest eventual test-retest effect. According to these, we analyzed the available results on cognitive performances at 12 months follow-up. From a comparison of performances of cognitive performances from baseline to 12 months follow-up, we did not observe differences in long-term verbal memory. Therefore, even if we use standardized parallel forms of Ray word lists, may be possible that the second list administered at 6 months is more difficult than the first list that we use at baseline and 12-month follow-up. This hypothesis will be tested further when all patients will reach the 12-month follow-up and by adding a control group of healthy subjects to research design. Within our population, there were also 6 patients with a diagnosis of mild cognitive impairment. We observed that no MCI patients had cognitive side effects soon after the procedure or converted to dementia within 6-month follow-up. Concluding, we can confirm that MRI-guided-focused ultrasound is safety from a neuropsychological point of view. The decrease of verbal fluencies can be considered a transient effect as the performances at 6 months recover at baseline level after a slight decrease that occurred at 1-month follow-up. There were no differences in cognitive performances after MRI-guided-focused ultrasound for essential tremor and PD patients. And in the last, do remember to pay attention to test-retest effect. Thank you very much for your attention.